Behind the daily stats, a closer look shows the brunt of this pandemic has been felt inside the walls of our state's nursing homes.
Tonight, in a new Target 8 investigation, we are learning about conditions inside West Michigan's deadliest spot, Samaritas Lodge in Grand Rapids. That's where state records show 31 people have died.
Target 8 investigator Ken Kolker is learning that the home now ranks as one of the worst for COVID patients in the entire state, up there with the bigger nursing homes in hard-hit areas of Detroit.
It got so bad here at Samaritas Lodge that workers wore plastic bags because they didn't have enough personal protection gowns. Loved ones who've lost relatives wonder why so many have died. The state is asking the same question.
This is the greatest spectacle in racing.
The family of F. Ryder Overstreet expected him to live longer, maybe long enough to watch one more Indianapolis 500 race on TV. That's him in the checkered socks. He had gone to the race 68 straight years, a streak broken a few years back only because of his age.
We didn't understand why he got this so quickly and died.
The 86-year-old great-grandfather, an Alzheimer's patient who lived in a private room at Samaritas Lodge on 32nd Street, died on June 18th of COVID-19 pneumonia, 5 days after he and his wife had celebrated their 61st anniversary by video chat.
It upsets me. My daughter is very upset, and she was very close to my dad, so it's very hurtful that he had to go in this way, that maybe it could have been prevented.
Her dad is among 31 Samaritas Lodge residents who have died COVID-related deaths. So when you heard there were more than 30?
I was shocked. Not surprised, but shocked.
76 residents have tested positive, along with 24 workers at the home, some in the last few days. 8 of the deaths were reported since early June, the latest on July 4th.
If I knew that it was going to turn into what it did, I would try to find a way to get him out of there and bring him home for a while till this was over. I didn't know that it was that severe there.
Samaritas Lodge has had nearly as many COVID deaths as all other nursing homes in Kent County combined. It ranks 6th for deaths among the state's nursing homes. The top 5 are in the hard-hit Detroit area and have more beds.
That's very concerning because that's not a very big facility.
31 COVID deaths, 125 beds, a 1-to-4 ratio.
If you had to send a loved one to a nursing home, I mean, would you choose one that has had 31 COVID deaths?
No.
No.
No, I would not. I'd quit my job and stay home if I had to, but I would not do that.
The director of AARP of Michigan says the COVID death rate at nursing homes shows a need for immediate change.
This is not rocket science. We just need to figure this out. People are literally dying while we're trying to figure all this out, and that's not acceptable.
It's not clear why COVID hit Samaritas Lodge so hard. The home passed a federally required infection survey in April. But inspection reports show 50 violations over the last 3 years, including 4 for infection control and more than $38,000 in fines. The state says it sent a team of inspectors to the home last week to investigate. A report on its findings, though, was not available. The feds require states inspect nursing homes when COVID cases hit certain levels, including 10 or more deaths. So far, more than 80 homes have hit that mark, most near Detroit. Nearly a third of the 6,300 COVID deaths in Michigan have come from nursing homes.
They're very alarming, and it's one area that I don't think anyone in the nation has completely figured out yet in terms of a national strategy or best strategy for nursing homes.
The Michigan AARP director questions whether hard-hit nursing homes are doing enough to control infections.
We're hearing across the nation that nursing homes still sometimes don't have the proper PPE, protective equipment, for their staff and or their patients.
The state long-term care ombudsman who represents residents at Samaritas Lodge confirmed that the home for a time used trash bags as gowns for personal protection.
I mean, if that's all you have, that's all you have. And I guess I have to, appreciate the fact that they were trying to provide and do what they could with what they had available. But that wasn't their go-to. It was just more that there wasn't any to be found.
There are residents who are wondering why so many have died of COVID-19 at Samaritas.
put your pinpoint on it, it would be we're hard pressed to say that this is the reason. Of course, yeah, I would say infection control, we always have to look at that. That's going to be a core thing to see, could they have done it better? Was there a failure in that?
It could also be, she says, the high number of memory care patients at the lodge.
They can't process why they might have to wear a mask, why we need them to wash their hands again.
Could this just have been bad luck for Samaritas?
Probably.
In a statement, nursing home officials said they have followed all county, state, and federal COVID-19 guidelines. The home last month replaced an administrator and the director of nursing, though its statement said that the moves had nothing to do with quality of care. A source at the home says it recently started mandatory weekly COVID testing for residents and staff. The source says the home is half empty after it sent most COVID patients to state-sanctioned centers.
It's been something that
The daughter of COVID victim Ryder Overstreet still can't understand how he caught it. He was in a private room and couldn't get around on his own.
That's what people's opinions are. Well, he was in a nursing home, you know, he was old. It doesn't diminish his life that he was in a nursing home.
In Grand Rapids, I'm Target 8 investigator Ken Kolker.
The governor has created a nursing home COVID task force with a deadline of August 31st for recommended changes.
Within the past hour, Samaritas sent us a follow-up statement, adding some more information about the situation at that nursing home. Quoting from the release now, when several residents tested positive concurrently, we recognized the need to isolate and quarantine for safety and transported several residents to COVID-specific hubs as directed by the state of Michigan.
The statement goes on to explain overall 15 COVID-19 positive residents passed away while in our care at the lodge, and half of those were hospice residents. 5 residents passed away in the hospital, and an additional 13 residents expired after being admitted to the hub skilled nursing facilities. Because of state requirements, those deaths were all attributed to Samaritas.
Continuing on, it's quoted as saying, we're closely working with the health department and area health care providers to care for those affected and to mitigate any further spread within the community. Additionally, we want to assure residents, families, staff, and the community at large that we'll continue to do whatever we can to remain transparent and provide the best care possible for our residents under these very difficult circumstances. You can read this entire statement from Samaritas over at woodtv.com.